Ok, hola, muy buenos días.
Good morning to all of you. Thank you for joining us in this weekly press briefing on COVID-19 here at PAHO. My name is Leticia Lin. I am with the Communications Department at PAHO, and this Tuesday I am replacing my colleague Sebastián Oriel in the facilitation of this session. Sebastian will be coming back next week to moderate this session. This session will last about 45 minutes and we will be accepting questions up to the end. We have already received some questions via email. And let me remind you that you can also send your questions through the Q&A button at the bottom of the screen. And we are going to ask you that when you are writing your questions, please do include your name and the media outlet you belong to so that we can identify you when we respond to your questions. We'd also like to remind you that we have simultaneous interpretation into English and into Spanish, and you can choose the language by pressing interpretation, that is the button also at the bottom of your screen. As we await for other journalists to join us, let me share with you that today the director of the Pan American Health Organization will be reporting to you about the current COVID-19 situation in the region, and she will also be addressing the impact of the pandemic on the mental health of the population, and she will also be addressing the impact in connection with domestic violence. Dr. Etienne is joined here by Dr. Jarbas Barbosa, Assistant Director of PAHO, Mr. Ciro Ugarte, who is the Director of the Health Emergencies Department, and Mr. Sylvain Aldiguieri, Deputy Director and also Incident Manager. Dr. Marcos Espinal, Director of the Department of Communicable Diseases, is not here with us this week, but he will be joining us again next week. Now, I would like to invite Dr. Etienne for her opening remarks. Dr. Etienne.
Thank you for joining this week's press briefing. Coronavirus cases in our region have reached almost 11.5 million, and regrettably, over 400,000 people in the Americas have died as a result of the pandemic. Our region continues to carry the highest burden of coronavirus disease globally, with 55% of the new cases reported this past week. The Americas have approximately 13% of the world's population, but 64% of officially reported global deaths so far. Currently, the biggest drivers of the case counts are the United States and Brazil. But we are now seeing an increasing trend in parts of the region that had remained stable for multiple weeks, such as the Caribbean. Even though a few locations have reported lower numbers after being hit hard, several countries are reinforcing public health measures in areas that are facing a rise in new infections, such as Peru, the Dominican Republic, Jamaica, and the Bahamas, Trinidad, and Tobago. This virus is unrelenting and requires the same from us. We must stay vigilant and keep transmission under control. The coronavirus is not only impacting our health, it's also affecting our well-being. We have been pushed to extraordinary lengths, and over the last few months, many of us have felt fearful of the infection or anxiety if we are sick. Some of us have had grief as our loved ones have succumbed to the virus. We have suffered uncertainty about the future as jobs and life as we knew it came under threat. We may have been overwhelmed by the news and the misinformation. And many of us are lonely or isolated after weeks of even months of social distancing. And while we may be dealing with this stress differently, we are all suffering, especially those affected by pre-existing mental health conditions. The COVID-19 pandemic has caused a mental health crisis in our region at a scale that we've never seen before. It is, so to speak, a perfect storm in every country as we see growing needs and reduced resources to address them. It is urgent that mental health support is considered a critical component of the pandemic response. I will speak about mental health in a little more detail. Mental health illness is a silent epidemic that has affected the Americas well before COVID-19. In our region, depression and anxiety are two of the leading causes of disability. We are also home to the second highest levels of alcohol consumption in the world, and emergencies can worsen these conditions. Surveys from the 3 countries in our region that are most impacted by COVID-19, the United States of America, Brazil, and Mexico, show that about half of adults are stressed by the pandemic. And early data show that many are coping by using drugs and alcohol, which can create a vicious cycle that makes people more prone to and can exacerbate mental health issues. In spite of increased needs during these challenging times, mental health support may be increasingly out of reach due to strict lockdowns or as the already scarce mental health staff and budgets are reallocated to the COVID-19 response. This is especially concerning for patients that are affected by COVID-19 and their caretakers. Patients who have tested positive for COVID-19 don't only experience physical symptoms, many also experience insomnia, difficulty to sleep, delirium, or even depression. Many persons are overwhelmed with fear of developing severe illness. Others are understandably worried for their lives. Initial research indicates that as much as a third of patients recovering from COVID-19 can have enduring changes in their mood and suffer from anxiety or depression. Doctors, nurses, and health workers are working longer hours than ever before. Many of them may be risking their own lives as hospitals struggle to maintain sufficient protective equipment, while others are being forced to make extraordinary choices as ventilators and hospital beds become in short supply. After months of operating in crisis mode, our health professionals are facing burnout, anxiety, and depression. On another note, let's talk about domestic violence. It is important to note that these ongoing stressors are also contributing to a related problem that needs urgent attention, a rise in domestic violence. Across our region, nearly a third of women have experienced intimate partner violence in their lives, and at least 1 in 2 children have suffered violence in the last year. And that is before the pandemic struck. Marginalized groups like Indigenous and Afro-descendant populations, migrant and refugee women and children, and those living with disabilities face a greater risk of violence. So the ongoing stay-at-home measures, coupled with the social and economic impacts of this virus, are increasing the risks of domestic violence. home is no longer a safe space for many. For example, in Argentina, calls to a violence against women helpline increased by over a third. And in Colombia, calls on family violence to a helpline multiplied early in the pandemic. Meanwhile, in Mexico, emergency calls for incidents of violence against women increased by over 50% in the first quarter in comparison to last year. These are only a few examples. It's happening across our region. The real extent of domestic violence during COVID-19 is likely underestimated, as survivors are stuck at home and support and outreach services have been interrupted. With reduced contact to friends and family or barriers in access to services and shelters, we are living survivors with nowhere to go. The cost of violence are extraordinarily high, so support to survivors cannot be put on hold. Amid this grim reality, we are seeing global leaders, community members, and families talk openly about these problems. Mental health and domestic violence services are essential services, and we must place emphasis on addressing the gaps that have been laid bare by the pandemic. Today, I ask countries to take the steps that are required to ensure that everyone can receive the care they need and deserve. First, countries must expand and invest in mental health services. We need governments to prioritize mental health as part of the response to the pandemic. And at the same time, countries must make investments to scale up services, to hire and train additional staff. One of the most effective and efficient ways to do this is to integrate mental health and psychosocial support within primary healthcare systems, so they're easily accessible to those who need them most. PAHO has been helping countries increase their capacity to provide mental health support at the community level amid the ongoing COVID-19 pandemic. A second critical step is to act with innovation. This pandemic has upended the status quo, so it is critical that health systems offer support in new ways. Almost every country in our region has expanded their mental health helplines, so those who need to can speak to trained responders and can access care while avoiding the risk of COVID-19. And finally, we must work to destigmatize mental health. Everyone who needs mental health support should feel comfortable asking for help. No one should have to suffer alone and without professional support, especially now. Naturally, some of the same concepts apply to domestic violence. These services must be accessible and integrated at the local level. We need innovations to reach and support survivors, and it is paramount to fight stigma. Violence is never acceptable, and survivors of domestic violence should not be blamed. PAHO has been helping countries to strengthen policies and services and to expand online learning for health workers so that they know how to identify and support survivors of violence during the pandemic. And it is encouraging to see some places using these novel approaches to ensure that survivors of violence can ask for help discreetly, such as through code words or hand signals. Friends, mental health services are foundational to our COVID-19 response and ultimately to our rebuilding process as well. We must step up so those living with mental health conditions, as well as survivors of violence, have the resources and the support that they need. This pandemic reminds us over and over again, like never before, that good mental health is necessary for the well-being of individuals and societies. Over.
Thank you, Dr. Etienne. Muchas gracias a la directora de OPS.
Thank you very much, Dr. Etienne. Now we are going to start with the questions that we have received via email, and then we will be addressing the questions we are receiving via chat. Let me remind you that you can use the Q&A button to send us your questions. Please do send them through that button in English or Spanish, and please remember to indicate your name and the name of the media outlet you represent. The first question.
What are PAHO's recommendations for ensuring mental health in children and adolescents within the context of COVID-19? Dr. Etienne?
Thanks for this question. As many countries in our region approach 6 months of public health measures, including physical distancing measures and lockdowns, we understand the huge impact that this has on the mental health of everyone, but particularly children and adolescents who struggle to understand the current situation and find it difficult to cope with not being able to see extended family and friends, as well as the disruptions to school and their normal social routines. When it comes to young children, one of the most important things that parents and caregivers can do is to communicate. Talk to them about what is going on and why the measures that have been put in place are so important, while of course using age-appropriate words and phrases. Take the time to listen to their concerns and to provide support and reassurance. We need to encourage play, maintaining routines, and helping children to stay in touch with their friends and their family via the telephone and the internet. It's also an important part of keeping things as normal as possible. When it comes to adolescents, this is very challenging. These open channels of communication are also really important. It's normal and it is okay to feel sad, stressed, confused, and scared during a crisis like COVID-19. And we are all feeling these things and talking about it and listening to your child and providing a space to talk and to offload helps to normalize these difficult feelings. For adolescents, it is also important that we model self-care and demonstrate healthy coping strategies. Helping them to structure the day and establish routines will also help refocus their minds towards productive activities and to ensure that conflict at home is kept to a minimum. But know that dealing with adolescents during this period is quite a challenge. There are lots of resources available. For example, the UN Interagency Standing Committee has developed a great illustrated storybook to help children understand and to cope with COVID-19. PAHO and UNICEF held a youth hangout session online last week about this very issue. So I would really encourage parents to have a look at our social media platforms and websites and to use these resources as much as possible. It is difficult for children and adolescents during COVID-19.
Thank you, Dr. Etienne. We are moving now to another question. This one comes from Elizabeth Bryan from the Eleutheran newspaper in Bahamas. And this question says, what is PAHO's current stance on approved therapeutics for the treatment of severe cases of COVID-19? There has been much talk about hydrochlorine by different presidents in the Americas and about others like remdesivir. Is there a current list of recommended approved therapeutics by PAHO? Dr. Silvana Aldiguieri, can you answer this question?
Yes, thank you for this question. Thank you to the colleague journalist from the Bahamas. I'd like to note that the question is focused on the treatment of severe cases. The recommendation of Pan American Health Organization is the timely application with quality of standard of care. The PAHO guidelines for clinical management of severe cases are available on the PAHO website, are updated on a regular basis according to the emerging science. The last update was late July for this specific guideline. It is important to note that dexamethasone steroids has been included for patients receiving oxygen, including severe and critical patients. This was one of the last additions to our guidelines. But also, in addition of this clinical management guidelines, PAHO is updating on a regular basis its review of article and publication following the GRADE methodology for mapping evidences or lack of evidences, and also the list of essential medicines for the patients that would be cared for in intensive care units. In conclusion, there are no treatment at the moment specific to COVID-19. But as I said at the beginning of my intervention, the timely administration of quality standard of care according to the clinical status of the patients is the key, and the dexamethasone use in patients receiving oxygen. Thank you.
Muchas gracias, doctor Aldiguieri.
Thank you very much, Dr. Aldiguieri. Now I have another question that we received via email. This question is by Daniela Sanchez from Factor 4 from Guatemala, and it reads, what is the prudential time for the delivery of results of tests to detect COVID-19? Public health facilities in Guatemala deliver results a month later, and this makes the follow-up of that case difficult. Based on the protocol in the country, only one person with symptoms could be tested. In the past, we could also test contacts, but is this part of a new protocol, or is this a decision based on each country? Dr. Ciro Ugarte, could you please address this question? Thank you very much. This is a question that applies to the country because the time it takes to deliver the results varies a great deal, and the result should be provided as soon as possible after testing. But you know that the test is taken, and to take that test, we need to have supplies. So tests are needed, as well as trained staff, PPE, and it is necessary also to record the whole process and also to send the test safely to the lab. The test has to be recorded at the lab level, and also a reconfirmation test has to be taken also for reconfirmation. So all of these steps and processes require a mechanism that could be quite prompt if the person is close to the lab and if all of the steps are carefully followed. But in the case of Guatemala, thousands of tests are done on a daily basis, and the labs are handling all of these tests. And those samples, even though the public sector is sampling more than the social security sector and also the private sector, it is understandable that the result takes longer. As to the situation and to who to sample or who to test, whenever there is a problem with standard test availability, molecular diagnosis tests, and other tests, priority should be given among the population. For example, a person that has been identified as a contact of a confirmed case needs to be analyzed as to what is the added value of testing that person that is asymptomatic and that regardless of the positive or negative result of the person he was in contact with, that person needs to be isolated for 14 days. But if a person has a positive result and then that contact is tested, but the result is negative, it doesn't mean that that person is not affected by the disease. It may be an asymptomatic case. So it is very important to assign priorities to tests, in particular when supplies are scarce and also when the timing may be prolonged. The country has been reporting through press briefings the results and also the number of tests and other diagnostics that are being used. And most countries are giving priority to testing those individuals that are asymptomatic. And this goes above the guidelines that we have here for PAHO and WHO. In the current context, it is extremely important to take into account that the test result indicates that only at that point in time when the test was carried out, the person did not have the virus or had the virus. So that is one of the elements that the contacts need to take into account to also implement all the precautions. And the delay in the delivery of the result is a challenge to implement the public health measures when the situation is uncertain. And that is the main failure of the systems and of the social distancing measures, because clearly we do not have the results. A month goes by, what are we going to do? So this is also an issue that is related to the mental health issue that the doctor just mentioned. Thank you very much. Thank you, Dr. Ugarte. We have some questions that were sent to us in connection with the vaccine. And now we are receiving other questions via chat. We will try to address the various questions, the various topics. So please bear with me as I review all of the questions I am receiving on that topic. The first question we have is by Maria Elena Castillo from the Republic of Peru, who is asking whether PAHO has an authorization mechanism as part of the emergency use of the vaccines, or whether they are proposing to continue with the regular system for pre-qualification of vaccines. And Melina Ochoa from Mexico had already asked us what the opinion is in connection with the phase 3 vaccine for coronavirus being developed by Mexico and Argentina for AstraZeneca with the support of the Oxford Foundation. And also the correspondent for Vertigo is asking us whether we could make a comment on the Chinese vaccine and the Russian vaccine, whether they could be offered to the market without WHO pre-qualification. And now I would give the floor to Dr. Barbosa to address the first block of questions related to vaccines. Dr. Barbosa. Thank you for these questions. There are several questions that have to do with vaccines, and we do understand why. First of all, it is important to recall that we do not have a vaccine that is available, and it is not possible to completely ascertain whether we are going to have a vaccine in 6 months or not, because even the vaccines that are undergoing the clinical trials and advanced clinical trials, it may turn out that the vaccine is not efficacious for specific age groups, or it has low efficacy and we need to wait for another vaccine. So those trials are considering all of the measures also being taken into account to reduce transmission in Latin America. The AstraZeneca vaccine is one of several that are in phase 3. The phase 3 clinical trial is the last phase, the last stage, but they need to vaccinate thousands of individuals, in some cases 30,000, 40,000 individuals, because this is the phase that will be confirming that the vaccine is efficacious against COVID-19. So this vaccine is already at phase 3 with other 7 vaccines, and it is and AstraZeneca is a vaccine producer that is also in advanced negotiations with the COVAX facility for vaccine access. And if this vaccine turns out to be a safe and efficacious vaccine, it will always be better to have more producers of the vaccine for countries to have better access to the vaccine. As to the pre-qualification for marketing the vaccine, for a vaccine to be marketed, it needs to be registered with the regulatory authority of a country. So a vaccine that is developed here in the United States is registered here before the FDA in the US, and it can access the market here in the US if it is registered, for example, in Lima, or it may be marketed in Peru, or if it is registered in Colombia or in Brazil, it may be also marketed in those countries. So the WHO pre-qualified vaccines are vaccines that have a different level of safety. They could be vaccines that are, for example, marketed through the revolving fund here at PAHO. The PAHO revolving fund, for example, the quality and efficacy authority for vaccines only acquires vaccines that are pre-qualified by WHO. So if a vaccine producer develops a vaccine and is only interested in marketing in their own country, they do not need WHO authorization. But if they would like to access the global market or offer the vaccine for the Americas region through the revolving fund, there is a need for pre-qualification. The pre-qualification process, if that pre-qualification process does follow, in some cases, an emergency process for some vaccines that do need to access the market more promptly, but all of the steps are followed to guarantee that it is a high-quality vaccine, a safe vaccine that is highly efficacious. So all of the news that we read about countries that some vaccines are advanced, that's when the WHO team starts talking to the producer and also to that country in particular to start reviewing that vaccine as needed. Thank you.
Thank you very much, Dr. Barbosa. Now, continuing with the issue of vaccines, but now addressing the issue of efficacy, Carmen Bao from El Político asks, and the question is in English.
That vaccines work less in people who are obese. Is that correct? And if so, are you worried that people in some countries in the region won't benefit from the potential future vaccines as much? Otra pregunta que llega de Francisco Morere de Cover News.
Another question from Francisco Morede from Cover News is, what's your opinion regarding the possibility of having adverse effects by these vaccines? So what do you think about the announcements that different countries have made regarding their vaccines? And what's the possibility of having adverse effects? Dr. Barbosa? Let me begin by answering the second one, adverse effects. I mentioned clinical trials. And in order for a vaccine to be authorized for use, a lot of tests, lab tests must take place, and these are called preclinical trials. Now, these tests are aimed at verifying whether the vaccine is safe, and then they move on to phase 1 and phase 2 in clinical trials, whose purpose is to ensure that the vaccine is safe. So, if a vaccine has adverse effects, then those adverse effects are assessed. Many vaccines have mild adverse effects, especially when compared to the protection and the benefits of the vaccine. But that assessment does take place during the clinical trial phase. And that's why it's so important to have all the clinical trials well documented and whose results are posted following the correct methodology in order to assess whether the vaccine is safe and state so firmly, because you can say adverse effects are only mild, but the benefit is much higher than the negative effects. Now, regarding the first question,
some vaccines, especially the influenza vaccine against the hepatitis A and B, may be may have a reduced effect in terms of generate protection among among certain population groups, such as people with more than 70 years, or people with obesity and others. But we don't know for sure that this will happen with the COVID-19 vaccine. Probably when you vaccinate during a phase 3 clinical trial, 40,000, 50,000, you will have people with obesity among these groups. And this will be a very important information because based on this performance, you can adopt a specific strategy. For instance, to have a boost 1 year after, or to have 3 doses or 2 doses. So this is the information that to have a final answer, we will need to review all the data that will be generated by the phase 3 clinical trials that are being conducted worldwide. Thank you.
Thank you, Dr. Barbosa.
Thank you, Dr. Barbosa. Now I'm going to read another question that we received via email a few minutes ago. It comes from Lidia Lopez from La Prensa in Nicaragua, and it says, this past weekend, over 3,000 public events took place in Nicaragua, and they were promoted by government institutions. What kind of guidance and recommendations do you have? What would you recommend to parents that are sending their children to public schools? And what could they do to protect them? Dr. Ciro Ugarte, could you answer this question, please? Of course. One of the most important actions to lower transmission is social distancing or physical distancing. And of course, public gatherings with lots of crowds is a breeding ground for the virus to go from one person to the other, and those events should be kept to a minimum. However, this is happening at the global level. Not abiding by social distancing measures, especially in situations where there's an apparent reduction in the number of cases, can later on result in a significant spike in cases at a mass scale, which will have a direct relationship in death rates because the health services can become overwhelmed in a very short time. So we shouldn't keep our guard down. On the other hand, opening schools is important because in those cases, children and adolescents must be protected as well. And not only protected by themselves, because we have seen that the impact in children and adolescents is direct in their physical conditions. Most of them don't have severe symptoms, but they could spread it to other people in their home, etc. But also because it impacts their mental health and it has long-term impacts. So if the conditions are given in order to teach virtually, that's the preferred option. However, if that's not the case, we need to come up with the necessary social distancing actions and staggering attendance in order not to overcrowd classrooms. And at all times, should we do what we have said from the very beginning of this pandemic: social distancing, wearing face masks, and hand washing. These should be ongoing things, ongoing. We should not let up. And even though we have seen that children do not present severe symptoms, there have been cases where those symptoms do appear. But mostly we need to protect people that have other conditions. And at home, the ones that will be most severely affected will be grandparents or the parents that have some kind of pre-existing condition or a family member that has some kind of chronic disease. And can you imagine what the impact would be on a child to know that because of their fault or because they brought the virus home, some family member suffers or falls ill? It will be very hard to manage that kind of guilt. And that's why we need to take all necessary actions in order to prevent children and teenagers from falling sick. So they can not only, but we need to take into account not only their physical well-being, but also their mental and emotional well-being as well. Thank you very much, Dr. Ugarte. I'm going to read a question we have received from the chat, and it's in English.
Dawn Smith from Eyewitness News Bahamas. She says, the Bahamas had only recorded 104 confirmed COVID-19 cases. However, after reopening to international travel, the country saw a significant increase in cases, now at more than 1,300 as of yesterday. Do you think the Bahamas reopened too soon? Does PAHO have a position on where the country went wrong? And then she adds that the Bahamas announced additional lockdown measures last night in order to help curb the spread of new cases in the country. What are your thoughts on lockdown measures that assist to flatten the curve but continue to create significant social impact on the country? Dr. Aldiguieri, can you take this question?
Yes, thank you for these two questions from the Bahamas. One is dealing with public health measures and lockdown, and the other is dealing with travel-related measures, including international travels. We are receiving constant updates from the national authorities of Bahamas regarding the number of confirmed cases and their response activities. We have noted from starting with the beginning of the month of August, an increase in cases, and the government has taken measures for expanding the lockdown, which was at the beginning of the month, focused on the island of Grand Bahama to the rest of the country and other islands. So when we speak about public health measures, we have to take into account a whole package of interventions, including non-pharmaceutical measures. It includes always hand washing and promotion of hand washing, social distancing, and wearing masks. But the national authorities have always at their disposal a battery of public health measures, including home orders, the limitation of the number of people, or the prohibition of gatherings, and also the limitation in terms of domestic travel. In the case of Bahamas, the travels between islands. In terms of international travels, what Bahamas is facing at the moment is a situation which is also observed in other island nations of the Caribbean. We have clearly detected an increase in reporting of confirmed cases after the reopening of airspace and the resuming of non-essential travels, which of course is related to the tourism industry. This is a situation with which the national authorities are going to deal with during a number of weeks or number of months, and they would have to take the decision with using some criteria, epidemiological surveillance criteria, laboratory surveillance criteria, and also the use of the number of beds that are occupied by critical patients in the countries. And also the modulating these public health measures according to the epidemiologic trend in the country would allow the countries to control their outbreaks or increase at the moment. I hope I have answered the concern of the journalist from the Bahamas. Thank you.
Thank you, Dr. Aldiguieri. I'm now moving to another question that came through email not long ago. I'm going to switch to Spanish. Esta pregunta viene de...
This question comes from Gisela Salamon from AP, and it says, some of the countries in the region are seeing an increase in cases, even though social distancing measures have been implemented from the very beginning. People are tired and they took to the streets to protest, for example, in Argentina. What's the forecast for the upcoming months? Dr. Barbosa, could you answer this question? Thank you for the question. The forecast for the next few months is to continue working very hard in order to lower transmission. Some countries in Latin America present a mosaic of situations. Some countries in the past 2 weeks have shown a trend towards a discrete reduction in the number of cases. However, we do not need to celebrate anything. We need to continue working very hard in order to stop transmission. Oftentimes, in one country, when we are assessing trends within the country, we see an average that's not reflecting what's truly happening within the country. So if we look at what happens in a province or a state or a city where transmission is slowing down, there could be another province or country or county or city where transmission is increasing. So we need to go state by state or province by province and then county by county to see where transmission is increasing and see what measures could be more effective. Now, in terms of protests, I believe that there is a concern, not only in the region, but all over the world. PAHO launched a report jointly with ECLAC a few weeks ago, and our director, Dr. Carissa Etienne, at the time pointed out to the impact that COVID-19 is having in a region like ours, which whose, who has a significant section of the population that lives in poverty and that makes their livelihood in the informal sector. So we need to have a joint work between health and the Ministry of Finance in order to address the social crisis. It is very hard to achieve adherence by the population to social distancing measures. We need to ensure then that each country finds where they are in a position to reduce transmission and take stricter measures in the areas where transmission still exists. So they need to continue working in a coordinated fashion and in an organized manner, including all the different sectors of government in an ongoing dialogue with society. Thank you. Thank you very much, Dr. Barbosa. And with that, I'm going to move to a question from Paulina Alcázar from Encadena News from Cancun, Mexico, which says, regarding the people that have been recovered after 20 days and have mild to moderate cases and they continue to test positive for weeks. WHO said that they can stop isolation without further testing. How does this apply to hotel workers and other workers that work in the tourist sector? Dr. Aldiguieri, could you answer this question? Yes, thank you very much for that question. The tourist sector must be ready to strictly implement non-pharmaceutical measures such as hand washing, wearing face masks, and avoiding mass gatherings in enclosed areas. But also in areas that have to do with detecting and isolating suspect cases, as well as contact tracing and the corresponding quarantine. It's important to mention the use of lab testing for the tourist population before their arrival to the country. But because that could give you a false sense of security. even following the golden standards in lab tests, which is a PCR testing. A negative result cannot be used to discard a potential recent infection in the tourist or the traveler, international traveler, let's say. PAHO does not recommend using antibody based rapid testing in these cases. So, to sum up, in the tourist sector, it is very important to strictly abide by transmission control measures and the use of non pharmaceutical measures. Thank you. Thank you very much, Dr. Aldigueri. And for that, I will move to a question from Cristina Coedo from Edición Mexico, Medica in Ecuador. And it says, what data from Ecuador do you have? Because apparently there's a very high death rate and there's no transparency regarding data. Dr. Ugarte, could you answer this question, please? Ecuador is one of the countries that has been sharing information online, but also through the international health regulations channels. And just like many other countries, the link of deaths to COVID is not very easy to confirm. So, in that sense, Ecuador has a number of deaths, which is, I think, over 6,000 with about 100,000 confirmed cases. So, the death rate is relative is relatively high compared to the number of confirmed cases, especially in the provinces that are along the coast. But now we're seeing that in the province of Pichincha, there is also a significant number of cases and increase in deaths. So I believe it is very important at times when the number of cases in Ecuador, as well as in many other countries, appear to be reducing, to continue to take the necessary protection measures. Because if we let our guard down and we all think that the worst is over, more likely than not, we will be surprised by a spike in cases, which will increase not only deaths that are directly connected to COVID 19, but also other diseases as well, because people cannot go to healthcare services because they are overwhelmed with COVID patients, or out of fear, because this is what happened in other countries, of going to the healthcare centers out of fear of contracting COVID-19. Thank you very much, Dr. Ugarte. I'm going to combine two questions that we have received on the chat. One is from Eduardo Vega from La Teja in Costa Rica. Have you cross-referenced the data between alcohol and domestic violence to see their relationship in during this pandemic? And now I'm going to switch to English.
Depictions media. Do you have statistics on the increased domestic violence against people with physical disabilities? Dr. Barbosa, can you address these two questions?
Yes, gracias.
Yes, thank you. Now, in terms of alcohol, there is ample evidence that has been built around the world regarding the close relationship between violence and alcohol use. However, we are yet to have data regarding the current situation during the pandemic. Those data are being generated, and it's very important to write it down accurately. It's very important to report them, and it's very important for national authorities to use all available data so that they can submit a complete landscape, because I'm sure it's going to be one of the areas that will require more attention in order to prevent these cases of violence.
Increasing rates of domestic violence against people with disabilities in the context of COVID-19 we don't have specific data. We know for sure, based on global reviews before the pandemic, that adults and children with disabilities are at higher risk of violence. For instance, children with disabilities are almost 4 times more likely to experience any violence than non-disabled children, and 3 times more likely to experience sexual violence, with girls being especially vulnerable to sexual violence. These vulnerabilities do not go away during COVID-19, but are likely to be exacerbated. We are working with the countries, the national authorities, and other stakeholders to strengthen data collection and analysis, including administrative data collected by the health sector. This is very important to have this situation in each country assessed in order to call the attention, in order to strengthen the social institutions that work to support people with disabilities to prevent this kind of violence.
Thank you, Dr. Barbosa. Estamos ahora ya llegando al final.
We are nearing the end of this press briefing, and I am trying to group some of the questions that we have received on the chat together that refer to the same topic. And from email, Alina Dieste from AFP said where the PAHO have joined their countries on Tuesday to join the machinery to purchase vaccine to fight nationalism. What do authorities in Latin America and the Caribbean say about this? How does the PAHO machinery work or facility work to ensure access to this country? Daniel from Wall Street Journal.
Especially with so many wealthy countries making billion-dollar deals with manufacturers. How can we ensure that PAHO doesn't get the second bite of the pie? What about the therapeutic dimension? También Catalina Lobo de Salud con Lupa pregunta qué está haciendo el fondo rotatorio.
Is asking what is the PAHO's revolving fund doing for the countries in the region to have access to the vaccines that are being developed for COVID-19. We also have a similar question from Tommy Liston in CNN, and I'm going to ask Dr. Etienne whether she can address this set of questions that have to do with access to this future vaccine. Dr. Etienne, go ahead.
Very, very important questions that more and more we need to be asking. Let me first state that equitable access to vaccines against COVID-19 is key to ensure that we will be able to protect all the vulnerable groups in every country, rich or poor, and to save millions of lives. So this is the first priority when the vaccines are available. So we are extremely excited by the speed and diversity of the research so far. And it really is exciting to see a pipeline of over 150 vaccines that are in different stages of development, and 8 of them already in phase 3 of clinical trials, as you were told by Dr. Barbosa. This really is unprecedented, but as is the pandemic as well. And so we need to start working now to ensure access, building on our vast experience in PAHO on delivering other vaccines. So we have encouraged and are encouraging our member states to join the COVAX facility. It's an innovative mechanism that brings together WHO, Gavi, CEPI, and several public and private stakeholders with an aim to share the risks and to allow low and middle income countries to have early access to the vaccines. According to economic criteria, 10 countries in our region, Bolivia, Commonwealth of Dominica, El Salvador, Grenada, Guyana, Haiti, Honduras, Nicaragua, St. Lucia, St. Vincent and the Grenadines are eligible to receive financial support from the COVAX facility to access the vaccine by donation. For the other countries in this region, COVAX facility will reduce the risks that is posed by bilateral agreements with specific companies, because we will have a basket that already has more than 10 manufacturers that are engaged in the process. Almost all countries in the Americas have already expressed their interest to join the COVAX facility. The immediate objective of the COVAX facility is to have agreements with vaccine producers to secure around 2 billion doses until the end of 2021. And this will allow each country to access a volume of vaccine that corresponds to 20% of its population. And they would use those to vaccine health and social workers, adults over 65 years of age, and other adults with chronic conditions, which are the most vulnerable groups to develop the severe form of COVID-19. All vaccines that are available through COVAX facility will be pre-qualified by WHO to ensure that they are safe and effective. So PAHO is participating in the COVAX facility through our revolving fund for vaccines. This is a proven mechanism that has been used for over 40 years. So we have 40 years of experience on the international purchase and deployment of vaccines to national immunization programs of our member states. So our participation is reinforcing the principles of solidarity, affordable price, and equitable access, which are founding principles for the revolving fund. PAHO's revolving fund for vaccines is recognized by the COVAX facility as a purchase mechanism that the countries in Latin America and the Caribbean will utilize to access the vaccines that will be offered by the producers to that facility, COVAX facility. Our long-standing experience will allow a rapid acquisition of process for all of our member states. I am happy to see that PAHO's revolving fund, Gavi, WHO, and others are working together to address the needs of the majority of countries through the COVAX facility. Some of our countries are just too small to be able to secure access to COVID-19. So we are supportive of this approach, and we are working closely with all of our partners and the partners that I mentioned before to build the COVAX into what is an effective tool to ensure access. We believe that solidarity and equitable access should be the pillars for COVID-19 vaccine efficacy, safety, and also availability. Thank you very much.
Many thanks, Dr. Etienne. Muchas gracias, Dr. Etienne, y a todos.
And thank you to all of the spokespersons that have joined us today and the journalists that logged in to participate. Briefly, we will be sending you the director's opening remarks as well as a recording of this press briefing. Remember that you can find more information on COVID-19 and what we're doing, etc., on our website, www.paho.org, and you can also follow us via email, mediateam@paho.org, where we will do our best to answer your questions as soon as possible. Thank you very much for your attention, and we'll see you again next Tuesday, 11 a.m. Washington, D.C. time. Thank you very much, and take care.